Okay, welcome back. And what we're going to discuss now is back pain and horse riders, and what you've all been really looking for is returning to riding, because the outcome of everything we've been discussing is so that you can return to riding safely. So just recapping, we've looked at the structures, the nerves, the muscles, the joints, the disc. We've discussed cause and effect and cause. We've discussed how your posture impacts, again, coming back to the cycle of cause and effect for pain. We've looked at the treatments, early intervention exercises, and rehab, how you progress a lot of the early intervention into more long-term management rehab. And we've looked at the specific rider movement patterns that you can start to introduce early, both mounted, unmounted, and then mounted. So what we're going to discuss now is, when do you return to riding? Now, we touched briefly on this in that you can return to riding when even if you've got some pain, but you need to, again, keep going back to the education. You must know what your pain is. If you've got some muscle pain, it's quite different to disc pain. Certainly nerve, pins and needles, referred pain, you do not want to be jarring yourself riding, because you will ride defensively and increase the pressure through your disc. You have to understand that the disc is a shock absorber, and if your shock absorber is not working, then you're going to ride defensively and create high risk for more injury. So it's absolutely essential that you do know that you can core crunch in any position. Now, remember when we did the core crunch, we did it in sitting or in all fours to begin with. I hope that when you practice that you establish the core crunch, certainly sitting in neutral position, standing in neutral position, lying in neutral position, that you can engage your core as you blow, and certainly that you've progressed on being able to engage your core either through breathing normally or engaging it with the blowout, but being able to hold it as you then take your next breath. Because the function of the core is to hold your spine while you move, not just while you blow out. So functional core training is being able to hold on demand and have a hold there all the time. So you should be able to walk with little or no pain, sit to stand with core stability, move the gym ball around with core stability, be able to bend through your hips with the woodpecker and not your back, and be strong, certainly with the woodpecker movement pattern for endurance. So before you ride, be able to sit, stand, walk, core crunch, and do that little movement pattern of the woodpecker, so that we put you into the saddle with established spinal support. Now remember, when you get pain, your core drops out. So the importance of the skill to bring it back in on demand overrides that pain inhibition. So returning to riding with back pain. Now some of this is logical, but I'll state the obvious. You want to start with a horse you know. You certainly don't want to get on somebody's horse you don't know. You want to be able to trust that the horse is not going to ditch you, not going to spook. So be safe. If you still got a certain amount of pain and your core is a little bit dodgy, doesn't mean you can't ride. Wear your back brace or your core belt and give yourself some safety mechanisms. It will give you some stability, but it's not the be-all end-all. It will also help control pain. Now start at the walk. Now this is assuming that people have had reasonably good, high-end injury here, because I do see a lot of people that really do have some bad injuries. So this is the extreme. For many of you, it might not be as extreme, but follow the principles. Be safe, wear your back brace, start at the walk. Now, I want you to start with your stirrups slightly shorter than usual. Now, the reason I do that is that if you keep coming back to the mechanisms of disc pain, we want to unload the disc a little bit. So if you take a little bit of the weight out of your seat and put it into your stirrups, we are unloading your disc. So this gives your legs a platform to rest on. I don't want you to push on it, I want you to rest on it. So be very clear that your correct riding posture is adapted straight up, as in your shoulder, hip, and your heels are in alignment. So at the walk, I want you to allow your body to sit relaxed, but certainly in tone. I don't want you to be erect and tense, but in that correct upright riding posture. And you all know what that is, and you all know what that feels like. Go straight to it, re-establish that habit, and we're going to start to reconnect those or recode those muscles after the injury has impacted many of them into what we call a dysfunctional or unstabilizing postures. So sit upright using your core, your scapular muscles, so between your shoulder blades, your core and your leg muscles, just engage them all. So move your head away from your heels, and what you'll feel is all of the pattern of those muscles will come in. If you don't feel your core, bring it in with a core crunch. You can do the blow and drawing in. Make sure you know it's in. I want you to walk on a long rein, not necessarily on the bit, because if you're going to hold your horse and bring them up onto the bit, you've got too many pressures involved and you'll wreck it. You'll go to defensive riding, and your horse doesn't deserve that. Just give him a nudge or a kick and get him into a swinging walk, long and low, swinging through the back. And as he swings through the back, you have to allow your pelvis to move. Now, remember we were doing on the bull the side-to-side pelvic movement? You are going to reproduce that movement pattern now. So as the horse lifts his hind legs and steps forward, your pelvis will lift, roll forward, and then the opposite will lift and roll forward. And if you've got your core stable and your head is moving away from your heels, you'll independently isolate that pelvic movement and you will start to swing through your back because you are in tune with your horse swinging through his back. So it's like a bit like a continuous passive motion machine. So your riding can be good therapy in many ways for pain relief, for movement, and for certainly functional movement training. Start with about 15 or 20 minutes and do have breaks. You may well find that this is fantastic and it feels good. When you get off, you might think, wow, now I don't feel so good. So we do use the riding for rehab, but remember when we do any rehab, we start with shorter sessions that are not loaded up. So if you've got no increase in your pain the next day, you can do this again over 4 or 5 days. And again, remember we're looking at the more high-end injuries here. As you feel confident, you can take your stirrups away and let your legs dangle, and you can carry your lower leg anti-gravity. Now, if you go back to what we were talking about, one of the movement patterns was triple flexion. If you don't have a stirrup to push against, you can hold your toes up, which will flex your ankle. You should then get a flexion through your knees and a flexion through your hip, and you can hold your hip in line with your heel, with your buttock, and your shoulders in line with your hips. So your shoulder, hip, heel line is established in that isometric movement, which is sitting erect and basically static, but moving with the horse. So the triple flexion leg movement pattern, which is a rider biomechanic movement pattern, is directly applied here, and that's a functional, lots of words here, that's the reason that we train in that functional movement pattern. So once you're able to ride pain-free at the walk with and without stirrups, you can start to then apply pressures, as in the walk, halt, aid, halt, walk, aid. Now, the reason I say we don't want to start this too early is that when you apply a seat aid, you are going to apply pressure through your disc. Now, rather than ruin the aid, wait until you are pain-free, or you can control the movement pattern, because as you engage leg to seat and you lean into your seat a little bit deeper, you are going to put pressure through your disc. Now, your disc must have restored its resilience, be relatively pain-free, and certainly not loading up. So simply doing a walk, halt, walk, aid will increase the pressure through your disc Again, understanding the mechanisms of riding with the mechanisms of your pain. So once you are truly with your horse, you've regained your muscle function, you can certainly then start to move through the other paces. So just going through that with the vision of the pictures now. Here we've got the triple flexion. We've got the static posture, elbow. Here we are a little bit holding on the bit. Cores engaged, neutral pelvis. We've got triple flexion, 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 and there is flexion here because the knee is forward. And we've got that static upright posture. You take that into the walk. As the horse walks, we've got movement through the hips. Here the legs dropped out, so not quite ready to hold the whole lot, and you can see that this rider's tipped forward. So riding with the rein in this case is going to increase the disc pressure. This is where you must know your horse. If you're not confident to ride on the buckle, then you need to be riding a horse that you're confident to ride on the buckle. You can either use the core belt, the back brace. I wear my back brace. I don't like the straps. They make no difference, except that they hold the brace up when you get on. Here, unloading a little bit, just going forward with core support, unloaded the disc because we've got stirrups in. Same here, starting to apply some movement patterns with the arms, and you can see here that the shoulder has dropped, so we've got a pressure through the back, through the disc. And again, looking at this posture here is reproduced here. So it all fits in. It's not just, you know, wasting your time. The functional movement patterns for riding are reproduced for a reason. So the rider exercises that we use unmounted, and this is where I apply rider biomechanics movement patterns. Remember, when we're looking at biomechanics, it's how you move. So you can incorporate your biomechanical movement patterns into your rehab program by applying the correct and specific movement patterns for riding, because riding is good for back pain. Falling off is not, and caring for your horse is not, and certainly riding incorrectly is not, but riding can be very good for your back pain. And this is where I get cross. Remember, my very first statement was never ride again. So applying these unmounted will set you up for a much better stabilisation and functional movement when you start applying your aids. Now, there are 18 specific movement patterns that I've designed for rehab for people with back pain, and specifically for returning to riding with back pain. And these are designed to improve rider skills, but also safety and balance. So first up, we have to have a look exactly what we need for good riding. Now, we've already touched on this. We need a good isometric posture with endurance. So if you're not already doing it, sit up straight, spread your legs, and as you're listening to this, just carry your hands in the position that you would with riding. Now, that's an isometric posture, and you do need endurance. If you're going to lift a cup of coffee to your mouth, you could probably do it 100 times in a row. But if I asked you to hold that cup of coffee for 5 minutes, you're just going to go, ugh, I can't. So that's what is the isometric. We need good balance. That's, you know, obvious, but we need the symmetry through the movement. So if your left shoulder is stiff and your right shoulder's not, you haven't got symmetry. If your left leg is stiff and your right leg is not, you haven't got symmetry. And you certainly need core stability, and you need core stability to be overriding when you have any pain, because pain will inhibit the core. So remember a few things. Jarring causes disc pain. Pain causes your core to drop out. Muscle spasm, muscle weakness, and asymmetries, and all of these things creep in. If you don't rehab them out, you're not going to end up with the best riding. So we want functional core strength. We want functional core movement patterns, and this is all what is required for riding. You want to be able to move your hand independent of your leg, independent of your pelvis, independent and in combinations of. So we rarely do use a hand independent, but we do it. So it's a skill that you can choose, that you established, and then you choose when you use it. I'm not going to tell you how to ride, but I'm going to give you skills on how to ride. You can choose then how you apply those skills. You certainly need fitness, and just keeping back to this, you need to be ambidextrous in your symmetry and ambidextrous in your asymmetry, so your lateral aid. So if you apply inside leg, inside rein, you want to be able to apply that both left and right equally. So looking at some of the movement patterns that I teach, and you can start to do yourself. This is if you sit on the ball and carry your hands like that, you are starting to train the isometric movement patterns. You want to be able to move your hands on demand. Now here, you're not going to ride around with that, but it's a skill that you will be using. So this is a training aid. When it comes down to being used in the dressage arena, it will be used in the invisible aid, but the pattern is still the same. You want to be able to move your hands horizontally, diagonally, and vertically. Yes, as I stated, not in these big movement patterns, but you train in the big movement pattern, you refine it down to be unconsciously competent so that you know you can do it equally left and right. And you need this to be able to apply hand aids. Now, as we all know, we don't apply hand aid without seat and leg, but you can train it independently and then combine it. If you try and train the end result, often people don't get the end result. Train the steps to get there. So we want to train your posture, and we want to then apply that so you can train your horse. You want to be able to work your hands alone, and you certainly want to have control when they're working in combination. Same goes for our seat and our legs. We want to be able to move our pelvis forwards and backwards and tilt it sideways. We want it to be able to roll a little bit. That comes down to the canter. We want to be able to tilt our pelvis one way or the other. That's a lateral aid using your seat, and that also comes in combination with the leg. So you can train these out of the saddle and apply them in the saddle. So these are rider-specific biomechanical movements on how to use your body, on how to apply the aid. So it's a lot more detailed than just more lower leg or move your leg forward or back. Been through the triple flexion, the adductor muscles, they're the muscles that are in a thigh. They certainly need to have good strength and tone, but if they're overactive, they'll push you out of the saddle like squeezing a fish. Now, most people know that, so the ability to have these muscles strong and toned, but also in combination with a certain amount of rotation, will allow you to sit deeper into the saddle. Now, if you've got stiff hips, you won't be able to do that. If you've got a stiff pelvis, you won't be able to do that. So again, looking at the movement patterns outside of unmounted are what we are looking at, how you can apply them mounted. You need active hamstrings, and you need that to be independent of your pelvis. Now that's quite difficult because the hamstrings is attached to the pelvis. But if it's fixed at the hips, it can control your knee. If you fix the knee, you can control the pelvis. And again, this is a rider-specific movement pattern of how you can use your hamstrings for a deeper seat and for a stronger lower leg. Now coming to the heel, you need to be able to have a long calf muscle and always keep the ankle flexed. Now, unfortunately, our walking mechanism causes us to push through our toes. So a rider-specific movement pattern is to break that pattern so that we can apply that skill in the saddle. And that is a unique, specific to riding only. We do not break that pattern in any other sport that you will play or in your normal daily function. It is unique to riding. And again, not very many people know that because they don't have training in the biomechanics. So again, having a look at some of these rider-specific movement patterns. Here we go with the pelvic tilt, being able to tilt it forwards and backwards or over tilt it, being able to engage the core in this upright position. Looking at the hand patterns, that's the horizontal split that I use. I train that deliberately. train it in the saddle, and then further to that, we look at why you use it and apply it to your training of your horse. You don't sit there doing that and say, I know how to ride. This is a movement pattern that you will progress to an aid. Same with this one. Here, carrying your hands, movement pattern that trains the upper body and the core. You go from that position to this position. Here's a movement pattern that engages it's exaggerated, using the trunk to apply more pressure through the seat so that you can get that deeper engagement through your seat. Yes, of course, that is far too much. It is a movement pattern that you're training. As you become unconsciously competent with this, because this will cause too much pressure through your back, you will be able to do it in centimetres, not in many centimetres. So these are rider-specific patterns that protect the back, engage the core, but are functional for your riding. Here we're starting to establish more strength through the shoulders. You're not going to ride with your hands like that. This is an exercise, but the ability to move the band away with one hand, hold it with the other, and then reverse it, again, creates symmetry through stability. We are dominant one side. This trains symmetry through the dominance. Now here we've reproduced the woodpecker. Again, you're not going to ride like that, but training the hips. Here we want the heel to stay lower as we do this in 2-point, as we get the hips to bring the body out of the saddle. So a lot more detail in these when I train people, but just giving you an idea of biomechanics, managing back pain, and how you apply it to your riding. You might look at all of this and think, wow, it's all a bit ridiculous. There is purpose behind the movement patterns. This is not the whole program, this is bits of it. Now, when you are pain-free and you are able to go on to trotting, now keep batting away at the rising trot. You will have a lowering into the saddle, obviously. If you don't control that and don't have stability, you're going to have an impact through your disc. That's causing a jarring, that will cause pain, that will cause your core to drop out, that will cause you to balance on your toes or your reins. So do not go to the rising trot until you are fully established at the walk and that you know functionally you can hold your core. So you're going to control the rising and the lowering. You're going to ride in light seat. There, we went through that a minute ago, the woodpecker movement. You must have your core engaged. I often get people to use a neck strap and lean onto the front of the horse, the top of the horse's neck. Again, this is getting you back to riding, protecting your back. We're going to unload your back, get you rising trot in shorter stirrups. Yes, you are not going to ride a dressage test like that. This is getting you back in the saddle and saving your back, protecting your back, building your muscles, and saving your horse from being a victim of your cause and effect. So get a neck strap and use it. Don't do any sitting trot because it causes a lot of jarring, and until you've got ultimate stability through your core and that ability to move your pelvis through those movement patterns with core stability, do not do any sitting trot. And you may not get to sitting trot for quite a few months. This all increases the disc, again, coming back to what we're dealing with, the disc pressure and risk of another, or extending the injury that you've already got. So no sitting trot, and certainly no sitting trot until you can ride all of the other paces. Now, as you strengthen, you can strengthen all your muscles through short stirrups, and you can strengthen all your muscles through the woodpecker and in light seat. Don't think that you have to sit upright and strengthen. You can do that unmounted. Because remember, we are returning to riding with an injury. We're not returning to the end result of the perfect functional posture. We are giving you rehab in your riding. Now, if your lower leg swings, shorten your stirrups. As your stability improves, you can lower your stirrups. But if you can't maintain that posture that you've progressed through to, then go back to a step lower. So ride in light seat. Put the weight through your feet and your hands, not through your back. Here, not quite enough core hold, so we've got a little bit of rounding. So be aware of this. When you ride, this is certainly in standing, when you trot, you do have to make sure that the hold is through the core and you keep the pelvis neutral, so you've got a little bit of an arch. Put weight through here and put weight through here. This is getting you riding. This is not how you're going to ride forever. Maintain as you become more upright. We've dropped the stirrups a little bit here. If you lose that skill, as these riders have done, then you've got to return to this. Gone to a round back, legs are swinging, starting to balance here, and you can see here there is no absorption of the impact into the saddle through the knee or through the ankle. It's boom. Pain, inhibition, balance on the horse, give the horse back pain, and so on and so on. Same here, gone to a round spine, more defensive riding. Certainly got an impact here, but the impact is not going to be absorbed because we've got not enough, a little bit more hip flexion here to take the weight off the back, not off the hips. Here's an example of rising, again, just demonstrating what happens. We push through our toes, we extend our foot, we extend our knee. Now, if you're doing this when you are trotting, you've got no stability, and the leg will swing. The balance comes through the reins, the jarring happens, and again, the whole process here, we are protecting the back, returning you to riding, and rehabbing you from an injury. The push off, I've got a spelling error, the action must be changed, and we do that with stretching and movement patterns. Now, when we go to cantering, it's a really good movement pattern. If you've got a horse that just lopes along, you can use it for your rehab. But again, you have to have core control, you have to have pelvic movement patterns established, and you certainly don't go to this if you can't do that. So stay away from canting, or again, go light seat. You can ride, but go light seat, because the purpose of all of this information at the moment is to protect your back and return you to riding, not return you to training your horse just yet. So your pelvis must be able to rotate forwards and backwards. You must have core control. You must have that balance through your lower leg, and you must have the endurance to keep it. So if you haven't got the ability to do this, as you can see here, tipping forward, that will give a jarring through the back. And even though here is not the pelvis hasn't gone into a flexion, we've still got a jarring because we've got too much movement. So start in 2-point in light seat, establish core strength and function, establish your lower leg, build strength and endurance with short time periods. Any incidents of back pain, go back to the step before, ride with these short time frames in shorter stirrups, and certainly do interval training. Now, managing back pain in horse riding. It's really important that pain is not your guiding factor, that function is. So functional core training, movement patterns, training never stops. And if you do stop, it'll impact your riding, because it will impact your muscle symmetry, strength, length, power, and endurance. So daily or often do stretches for your postural muscles. Daily or often stretch out your riding muscles. And I'll give you a few that you can do. Just that one laying on your back with your arms out, that's one that I do every day. Rest. Don't be afraid to have a couple of rest days. You get adaptation of muscles. Now, if you don't rest, you then get a build-up of fatigue and a reduction in resilience. So rest is really important. I go through a little daily routine. It takes me about 5 minutes to check, review, maintain, and if I can't do it very easily, then I will incorporate a little bit more regularly. So it's not a matter of doing it every day, doing it often and coming back to managing no pain. So you might have regular massage, physio for joint mobilization, for a few stretches, chiro. Again, you choose what works for you, but you want to manage maintaining good movement. Do not ignore micro pain, because your micro pain leads to macro pain. Your macro pain leads to starting again with your rehab. If you need to, wear your back brace, and if you're tired, or have a lot of heavy work to do, put your back brace on. It's much easier to avoid an injury than it is to treat an injury. But having said that, do not think that your back brace is going to save you from every episode of poor movement. Again, coming back to the education, applying these movement patterns, managing no pain, and wearing your back brace as you see fit to help you, not to necessarily save you. Now, don't be stoic. Be selective with the choice of your horse and your discipline. If you want to go eventing, build your body to go eventing. If you're scared stiff of jumping, don't go jumping, because you're going to ruin your riding, have high risk for injury, and you're going to, even worse, ruin your horse. You need to look after yourself because nobody else will. Now, coming back to stable management, it's not all about riding. Get some help with rugging and unrugging in the early stages, because twisting, lifting, bending, feeding, carrying feed buckets, all of that stresses the back. Coming back to the education of what a disc injury is. If you're going to micro-stress your disc by looking after your horse, and you will be, and don't think that the person who's doing it for you is not as well, but you need to restore your body to pre-injury status and then manage these movements or the things that you have to do with better quality manual handling. And certainly that's part of your rehab, learning how to rug and unrug with a good core hold and maintaining good spinal alignment. Manage no pain. Manage no pain, because when we are not in pain, we think we are fine. You may well be fine, but manage it, because you don't want to return to another injury, because an injury on a previous injury is a worse injury. It's not the same injury. Now, we've been through quite a lot with this little series. We've looked at the structures, we've looked at the cause, we've looked at the effect, we've looked at treatment, we've looked at early intervention, we've looked at the importance of your core. I've given you some early intervention exercises, some early intervention movement, functional core movement. If you've got any questions on any of those, send me an email, contact me through my Facebook page. You can send me contact through, have a look at my Applied Posture Riding website. There's a lot of information on there that is free and relevant to your riding, obviously. Follow my Facebook page. I've got lots of advice and general tips and information, and certainly I'm contactable through that page. If you'd like more information on the Applied Posture Riding Rider Biomechanics program, I've given you snippets of that here. Then you can go to this. Oh, that was clever of me. I've just given you the membership without giving you the link. Go to my riding website, my Applied Posture Riding website, and you can find information off there. So all of my training programs are there, and lots of information about back pain and many other topics. So I hope you've enjoyed that. I hope you have learnt something. Like I said, ask me a question, but please don't take back pain lightly. Don't be put off by someone telling you to give up. Go through the treatment, go through the rehab, apply the biomechanics, break yourself into riding gently, and enjoy your returning to riding. So thank you for your time, and I hope you've learned something from that.